Professor Jones, thank you so much for the opportunity, and thank you for inviting me to this illustrious panel, and so wonderful to see so many people joining us this evening. I do want to touch on two separate areas today. One, the religious side of this, and one, what I will loosely term a sort of rights-based, legal, ethical side to assisted suicide. I will leave the very fascinating connections to eugenics to Professor and Salmasi and others as well. But obviously this is a subject which is not just of a concern to us as a religious community, but touches on something that we have a particular sensitivity to. I want to start by looking at what you actually just said before, Professor Jones, about the sort of the front end of assisted suicide being one of autonomy, one of personal choice. And this is something that's important because I think it helps to frame the issue for people of a religious belief and why religious people would have something to say about this particular subject in the public square. So we don't view God merely as the creator of the world and the universe. We view God as being intimately involved in the running of the universe, and his laws reflect not just his divine will, but what is right for all humanity, not just for us. That doesn't mean that we impose our views on others. That means that we believe that his laws are absolute and immutable. Jewish ethics is derived from Jewish law. And although there are some interesting discussions to be had about the concept of natural morality, of our own perception of morality, and how that meshes into Jewish law and Jewish ethics, even though room is left for that concept of natural morality, Jewish ethics really fundamentally is based on what is written in the Torah, in the Hebrew scriptures, and is also derived by our sages in the Talmud and in the coded laws that come from the Talmud itself. Human morality does have a place, as I said, but this is only to forbid what God has permitted, not to permit what God has forbidden. The value of life, therefore, is something which is absolute and non-negotiable. It is regardless of the quality of life, however painful or pitiful it seems. It lies beyond the realm of human touch. Attempts to claim that religious text-based approval for assisted suicide, as has been published recently in the BMJ, in my mind, are contrived and rather cynical. While everything must be done to alleviate the pain of someone who is terminally ill, or in fact, not terminally ill, anyone should be given the right treatment and should be given the best treatment possible, it is forbidden in Jewish law to intentionally accelerate the death of a patient, even when they are legally competent and wish to die in order to end their suffering. This has been codified by many of our religious leaders who are involved intimately with medical law. And fundamentally, the sort of contemporary Jewish perspective on this is quite clear. There is absolutely no room whatsoever for any doctor, Jewish or non-Jewish, to end the life of a patient prematurely. There are, however, precedents in our literature about praying for a merciful death. One can pray for someone who is terminally ill to die, or who is suffering in pain to die, because that at least puts the responsibility squarely with God and not with us, because it is for God to decide, not for other people. Human logic may lead us to think that the person who has a hopelessly poor quality of life, who is suffering unbearably and wishes to end their life, should be the primary moral force when determining when life should end. Okay, there is a very powerful and emotive group of people who have suffered enormously, who have watched relatives suffer enormously, and we should, at the very least, show them the respect that we understand their suffering and that we are compassionate human beings. We all are. Wherever you lie on this debate, we all have compassion, we all understand. However, what we see, what we detect, is that although supporting the terminally ill emotionally and caring for them from a medical perspective is the absolute requirement, when it comes to providing this autonomy to end someone's life early, to assist someone to effectively commit suicide, this is a step way beyond what is morally acceptable in society in general. In 2006, Rabbi Sachs, Zichron Livracha, of blessed memory, quoted the late Austrian-British economist and philosopher F.A. Hayek, who notes in his book entitled The Fatal Conceit, The Errors of Socialism, that human intervention in history has often been catastrophic. Yet those who came before us were not foolish, he writes. How did they make what seems in retrospect to be disastrous decisions? Hayek's answer was the law of unintended consequences, which says that whatever you foresee as the result of your choice is only a small part of the story. Decisions have ripples of consequence no one can predict at the time. Our knowledge of the future is unlike our knowledge of the past. We can see clearly in hindsight, but in the case of the future, we can hardly see more than a few feet in front of our eyes. The legalization of physician-assisted suicide is deeply concerning. There are many hidden dangers, not least the deconsecration of life itself. The results of this can be seen fascinatingly in countries such as the Netherlands, which have some of the most liberal laws when it comes to euthanasia and assisted suicide. In a paper published in Nephrology, Dialysis, Transplant of this year, the authors detected a large increase in patient voluntary dialysis withdrawal, which accounts for the greatest cause of death among renal patients and has been steadily growing since the year 2000. The authors of this paper suggest a link between this growth and changing societal attitudes to life and the acceptability of treatment withdrawal in the Netherlands since the legalization of active euthanasia in 2001. In other words, the legalization of physician-assisted suicide has had a societal change in the very concept of life itself, of whether patients should continue treatment or simply give up. Hayek held that the simplest way of avoiding catastrophe is to keep a few simple rules that have proved their worth by ensuring the survival of cultures that kept them. There are clear dangers to a very large group of incredibly vulnerable people when it comes to assisted suicide: the elderly and infirm, the terminally ill, and those in chronic pain. These dangers are a price too large to pay for providing a benefit to a relatively small group of people. Now, one may argue that there is no place for religious views in public life, regardless of the fact that there are many non-religious perspectives and non-religious concerns when it comes to assisted suicide. However, given that we live in a secular society, we don't live in a theocracy, why should someone with religious views air their views in this way and seemingly impose their religious positions on what should be a secular debate? The question is, however, if the ethical direction of the country is simply set by human lawmakers, then at the very least, the views of religious leaders and those who hold religious views are just as important as secular voices, if not more so, given that the foundation of morality, even human morality, comes from religion itself. In case you thought this was an exercise devoid of compassion or emotion, I have had the privilege in my professional life to be present a number of times at the time of someone's death. But my first experience of this was working as an auxiliary nurse for the British Nursing Association when I was a student. I was studying medical physics and I wanted to see the sharp end of medicine. I saw terrible things. I grew up very quickly during that period. I saw patients in chronic pain asking for morphine when they already had the highest dose they were allowed. I saw the elderly and terminally ill in states of great indignity. But at no point did I seek to devalue the life that they had and think to myself that they would be better off dead. I did my best to treat and care for them until their very last breath. And I watched doctors and nurses doing exactly the same. That is the kind of country that I want to live in. A country that safeguards the weak and the vulnerable and does everything to treat them until God decides that their time has come. Thank you very much.